In the northwest farmlands of Moffett County, Craig is a center for agricultural services. The city generates electricity, curates local history, and draws visitors to the elk hunting capital of the world.
You can be outdoors doing anything. I mean, whether it's fishing, hiking, hunting, camping, throughout Craig, going to the brewery.
For many people in the Yampa River Valley and south central Wyoming, Craig is most importantly about health.
For hospital care, we're the only hospital within 50 miles.
The Memorial Hospital is considered a critical access facility because of the remoteness of its 24/7 emergency room, which had more than 6,000 visits last year. That's a big change from Craig's early days.
Really difficult. If you had any serious medical issues, you would have to be transported to Denver. And once the railroad got here in 1913, it changed the format of how everything operated, but it still was so isolated that if you had a major medical issue, you were probably in trouble.
At this Center of Regional Healthcare, there are concerns about impacts from H.R. 1, also known as the One Big Beautiful Bill. That law makes substantial cuts to federal programs, including Medicare and Medicaid, which presently cover more than half of Moffett County patients.
And so what that's going to translate into is less people are going to be insured. And there's two things I'm worried about there. Of course, the first one is if they're not insured, they don't want to seek care, and then it's just going to end in catastrophe. So that's my first concern. The second concern is kind of a long game concern, but if the patient gets sick, they're uninsured, and they still come to the hospital, which they should if they're sick and they need emergent help, there's a good chance they won't pay for that, and that then falls onto the hospital. That could equate into hospital shutting down. You can't operate at a loss for forever.
Without that, rural communities will dry up and die. Without health care, without the other amenities that you have in a big city, why would you come out to rural Colorado?
Changes to Medicare and Medicaid funding will come at a challenging economic moment for a valley that has mined coal since the late 1800s.
Starting this year and going forward for the next 5 years, the plan is to close the coal mines and the power plant. Our community is moving away from extractive energy, and so that's been a big change for our community.
Energy sector workers who are insured now may not find that kind of health coverage in their next jobs.
A lot of them are going to go to small or medium businesses where they're going to have to cover it on their own or not cover it at all.
With Craig Unit 1 to be closed by the end of the year, there is more focus on what jobs may follow a new natural gas plant than on coming changes to Medicare and Medicaid.
I think many consumers think that this is just messaging from one party versus another party, and it isn't necessarily going to impact them. So until people start losing their coverage, I think it's going to be largely not seen as an issue until it starts impacting those people directly.
Memorial Hospital administrators are looking at how they might make up for Medicare and Medicaid cuts, expected to start in 2027. The hospital has already eliminated home health and hospice care and closed its obstetrics unit. For the local Colorado, I'm Jessica Sachs in Craig.